We're going to demonstrate an ankle taping technique for inversion injuries, which typically injures the anterior talofibular ligament over here, which is usually injured because of these kind of strains on it. And first we'll use Underwrap, which just helps to protect hairy legs and makes it a little bit more bearable for the patient. It's very easy to tear, and we're just literally going right around the ankle. Just lift your leg for me. And it rips very easily. Thank you. And then I like to use the Hypafix for what we call an anchor. And the anchors are basically going to act as supports to stick the other taping to. Just lift it up. Thank you. And you just split the paper there to pull the paper off. I'm just going to be cautious with this tape because it's quite static, as you'll see. The reason why I use this as well, apart from it adhering very well to the skin, it's also very porous, so it allows the skin to breathe, and it's also hypoallergenic, so if people are allergic to tape, they're generally not allergic to the Hypafix. If you just lift your leg up for me. And generally we make sure we have some of it adhering to the skin and some of it adhering to the actual underwrap. If we had to have it all around the underwrap, it would just slide off with the next bit of taping. And the height of the Hypafix is approximately the musculotendinous junction. You don't want to completely restrict the calf over here, so we have it just over that musculotendinous junction there. The next thing we're going to use is the rigid Leukotape, which is a rigid tape. This one is the 38mm size, which is quite a nice size I tend to use for most taping. And first we're going to measure it. We're going to start here on the medial side, work our way out just to give it a measurement. And depending on the size of the ankle or foot that you're dealing with, we're going to cut two or three of these strips. You can rip the Leukotape as well, but I find you distort the tape a little bit by ripping it, so I like to just cut them. And what we're going to do next is what we call the stirrups. So we're going to start on the medial side, just over there, make sure it adheres to the Hypafix. We're going to come around the ankle. Now I want to encourage patients to keep the foot in a dorsiflexed and an everted position. Make sure you get out all your creases. We're going to just give it that extra little bit of a push to stick to there. Well, that one's just a little bit too short, but that will be corrected by the next one. This time we're going to move a little bit more anterior. We try and overlap the tape roughly by half. Come over the malleoli, and the tension is on the eversion and dorsiflexion. You can see already we've got a little bit of creasing happening there. And make sure we stick it nicely down. And this basically helps to just keep the foot in an everted position with the tape. I know some taping techniques you can have a little horseshoe here to lock them in, but I tend to lock them in with a final bit of figure of 8, which I'll show you in a minute. We'll start again. Immediately we're overlapping by half a little bit again, making sure we get nice tension on the eversion, and we stick it down. We'll try and stop the tape just short of the end of the Hypafix there, otherwise it tends to pull it off and it'll be tender on the hairs. And now we're going to lock these into position. So we're going to cut exactly the same length that we had earlier on. Just locking these stirrups into position, like so. Okay, don't worry about little bits of gapping here, that will all come together when we do the next bit, which is the figure of 8. So keep your foot in that position. For the figure of 8, I like to use the 5 centimeter Elastoplast, which is a elastic and adhesive tape. They do come various qualities. The most important thing about using this tape is never from a brand new tape go straight onto the foot. Always unroll it a little bit first, take some of the tension out, roll it up, and then start your taping. And we're going to start from the medial aspect down. We're going to put our own tension on it, not the tension that comes on in the factory, and we're going to push again the foot into eversion and dorsiflexion, coming around the front of the ankle, and this is where we're going to lock the actual stirrups into position. We don't want to strangle the Achilles tendon, so just loosen off slightly around the Achilles tendon, come around the front, and we're overlapping by half. Again, this is coming to the end of the bit that I've just unrolled, so unroll it a little bit again, roll it up gently, and we're going to apply our own tension, and try not to pull on the tape, try to actually apply the tension equally by pulling on the roll. Again, we're just enhancing that dorsiflexion, eversion, coming around. Remember not to strangle the Achilles, come around the front, and we'll do one more, again depending on the size of the ankle that you're dealing with. And then we just tidy that up, again by very loosely, just going up the ankle, just to hold everything in position. And there we are. Obviously what you do want to make sure is that your taping's been effective, so you get the patient to stand up and make sure that it is actually restricting inversion and plantar flexion, and that it's not restricting your circulation in any way. So are you comfortable with this? It's not cutting off anywhere. If they're weight bearing and they do find that it is nipping a little bit over here usually, then what you can do is just using a blunt ended scissors and just make a tiny little snip in the tape, and that releases some of the tension off the edge. The other thing, if they feel that it's not stable enough, you can reinforce it with the rigid tape. So you could repeat the figure of 8 over the elastoplast with the rigid tape. It's not as easy to get the turns, and generally the elastoplast is much more comfortable, particularly if there's still little bits of swelling around the ankle. But if you want it a little bit tighter, a little bit more restriction, then use the rigid.